Postoperative care for implants. Generally, placing an implant is not nearly as intimidating as it may sound. Typically, the postoperative course for placing implants is less discomforting than having the tooth removed originally. Usually patients require a day or two of Tylenol or ibuprofen, that kind of pain medicine. Occasionally they'll need several stronger pain medications than that, but typically not. There's typically very little bleeding or swelling associated with implant placements. Once the implants have integrated and they have been restored by your general dentist, they do require maintenance. It is true that dental implants don't decay, but they can get inflammation. If your oral hygiene starts to dip a bit, you can get plaque and calculus around the implants, and that leads to gingival inflammation, gingivitis, and eventually bone loss around the implant, which we call peri-implantitis, which is kind of a takeoff of periodontal disease. And that can progress and needs to be monitored and treated quickly. So if you do get your implants placed, it's important that you maintain good oral hygiene and regular dental visits to keep professional cleanings. Postoperative care after implant placement is actually quite simple. Generally, for the first several days, you're going to want to chew on the other side just to reduce the discomfort that you're having. If you do chew a bit on the implant, there usually is a bit of a cap that sticks up through the gum tissue a couple of millimeters. That's okay. That's not going to hurt anything. Typically, there are a couple of dissolvable stitches around these implants. That's what we want to have healed. Those typically resorb within several days. Brushing and flossing is important. You can continue to maintain good oral hygiene. For the first 5 to 7 days after the placement of the implant, you can refrain from brushing directly over the implant. After about a week or so, you can go ahead and brush right over the top of that implant. If you do get a little bit of bleeding in the first few times of doing that, that's not to worry. That's not a problem. That's generally expected as those tissues are still healing. If you'd like to talk more about bone grafting or implants, please don't hesitate to give us a call and schedule a consultation.